Hi Lucy, we're going to hoist you off the floor, okay?
As a safety measure, 2 members of staff must undertake hoisting procedures. This task should not be hurried unnecessarily, therefore avoiding potential anxiety for the patient. One person reassures the patient and makes them as comfortable as possible, whilst the other collects the hoist and sling. Explain the process clearly, ensuring there is adequate space to manoeuvre the equipment. The most appropriate size sling is used to ensure patient safety. The following measurement guide of head to the base of the spine, hip to the knee, and shoulder to shoulder can be used to gauge this. Fold the sling in half lengthways. Roll the patient onto their side and tuck the sling under their body.
Roll towards me. Okay, that's fine. You all right there?
Yep.
Okay. You're just going to feel this go underneath you, and you're going to feel a little bit of a bump as we roll you on your side.
Roll the patient back onto the free half and unroll the underneath section of the sling in preparation for tucking under the thighs.
The other side. Okay, and roll you back in the middle when you're ready. Okay. Your head okay?
Yep.
Just gently tilt your chin. Okay. Fine? Happy with that?
Yep.
Okay. Right, we're now going to bring the hoist in.
Bring the hoist into position.
Knees for me.
Lower the spreader bar to a point where you are able to attach the sling clips easily.
Just going to see this bar lower. And it's going to come quite close to you, but it's not actually going to touch you.
The top clips are connected first, ensuring an audible click as they engage. Repeat the same process with the lower clips.
Okay, and now we're going to attach the bottom.
The leg pieces are tucked under the thighs.
Okay, Lucy, we're just going to...
This is essential for supporting the weight of the legs. Ensure sling fabric under the thighs is smooth.
Okay, Lucy, we're going to lift you off the floor.
The brakes on the hoist have not been applied to allow for free movement of the hoist.
Is it coming up?
As the hoist takes the patient's weight, it will move slightly. This movement prevents the patient from being pulled against the floor surface, as could happen if the brakes were applied.
Okay, Lucy, we're going to pop you back to bed.
Okay, I'm just
With the bed at the optimal height and the bed brakes engaged, manoeuvre the hoist so that the base moves smoothly under the bed.
Pop your feet out.
At the same time, position the patient correctly over the bed.
You're on top of the bed.
As the patient is lowered,
Onto it.
you can make further positioning adjustments, as necessary, to both bed and hoist to obtain the most favourable placement of the patient on the bed.
Okay, we're going to take the bottom clips out first.
Remove the sling, legs first, and then shoulders.
Okay, and the top ones. Okay. Yep. And take the hoist away. And
Raise the spreader bar and remove the hoist.
Okay, we're just going to take the bed up, Lucy.
If required, readjust the bed height so that you are able to work in a comfortable and upright posture, thus avoiding leaning over the bed.
Lucy, just as you did before, take both knees up slightly.
To remove the sling from under the patient, repeat the rolling technique. Roll the patient to one side, gather up the sling,
Feel the bump as you come back over the bed. Okay, ready?
roll the patient to the other side, and remove the sling. It is now possible to use the profiling facility of the bed to make the patient as comfortable as possible.